And from the Twin Cities, from Alina Health, Jess Roberts and Hilary Hardin Ferguson.
I'm here today as a patient. I have trigeminal neuralgia, which is a neurological disorder, and I get to frequent the healthcare system. And so this is how I perceive the healthcare sees me. We've heard perception is reality, and I think that perception really is a decision on how we choose to see something. So I see myself, my perception of me is not somebody who sits in a doctor's office for 10 minutes for their every 6-month appointment, but rather someone who kind of checks that off their list, goes about their day, goes home, has fun with their family, and happens to have a neurological disorder. I don't see myself really any other way. I was diagnosed with trigeminal neuralgia while I was earning my doctorate, and my doctoral program saw me as a liability. They actually had 3 separate meetings on maybe we should look at taking some time off. Because they researched it and saw online that it's nicknamed a suicide disease. But I saw myself as somebody who would persevere and ultimately graduate. Then I became a success story. So that's special for them. But I always knew that I would finish. I just happened to be diagnosed with something while I was on their clock, if you will. And I'm proud to say that I never once wavered in that decision. Society sees me, people who know what I have, or they know that I've had 2 brain surgeries, will often say, oh, how are you? And I want to react in a way that's not appropriate. Instead, I just say, I'm good, how are you? And I don't like to be seen that way. I like to be seen as Hilary, and maybe remember I have something, but don't get crazy. And I do participate in society just like everybody else. This is me out in society doing something that normal people do. And I'm at a paint pub. And for me, when I go into a situation like that or like this, I make my own accommodations. I look at where the air vents are and I figure out what's going to trigger my shocks that I have from trigeminal neuralgia. My caregiver sees me in all these different ways, sees me in society, saw me throughout my doctoral program, sees me going to all these different appointments, and sees every facet of who I am, and knows that I do have this new addition to my life, but I still am Hilary. And that's how I also see myself, the same way my caregiver sees me. I'm very, very lucky in that regard that I have a caregiver who sees me the way that I see and perceive myself. And I would like to transition to the fact that I want to do more. I want to make sure that I'm somebody who can do something with what I have. I want to make a difference. I want to come to conferences like this. I want to be at conferences like the picture there. It's a National Trigeminal Neuralgia Association conference. I want to do anything that I can to show that patients are just people too, living their life, and they happen to give you those 10 minutes or whatever that might be for that day.
So contrary to popular belief, the healthcare is not actually broken. It's doing precisely what it was designed to do. The problem is it wasn't designed to do the things we now ask of it, namely support people beyond being the patient. This problem persists mainly because we focus all of our innovation efforts around this, the patient, rather than around this, the person. And as Hilary has described, her experience in healthcare can be very different than what's important to her, period. The latter requires health systems to get outside of our day-to-day, get outside of our institutions, and sometimes get outside of our comfort zone, all in an effort to build a more robust capacity for institutional empathy. Empathy for the communities we serve, and more importantly, the communities we don't serve. Empathy at its core is about humanizing and simplifying the most complex health challenges by organizing efforts around the lived experiences of those that are most impacted by the problems. Now, empathy within a health system, a large health system, can't be another initiative, program, department. It must be embedded within the day-to-day operations, strategy, and most importantly, culture, just as it is with most successful businesses. Empathy truly is the birthplace of innovation. Now, health systems must become far better at uncovering and delivering services that better align with what it means to be healthy. A great start point is what we're doing at Alina, getting frontline staff, leaders, out of the office and into the communities where people, not patients, experience health or a lack thereof on a daily basis. Now, if we were to change healthcare, We can't continue to sort of organize our efforts around organizational structures or disciplines. Rather, we must organize around the problems as they exist. So our call to action tonight is for all of us to start as we started here, with the people that power health. Thank you.